Welcome to State of the Heart, the monthly podcast from the Community Care Network of Kansas. I am Denise Sisman, CEO of Community Care. Each month, State of the Heart will explore how we, our partners, and state leaders achieve our mission to deliver equitable, whole-person care to all Kansans, especially those who are underserved. We will explore foundational beliefs, policies, and practices through the lenses of community, care, network, and Kansas. Today, we shall discuss the theme of network. Joining me is Matthew Schmidt, CEO of Health Ministries Clinic in Newton, and the president of our board of directors. Matthew is a true visionary, innovator, and collaborator. We are so happy to have you here today, Matthew.
Yeah, it's great to be here. Thank you, Denise.
So let's dig in, Matthew. I'm going to talk about the important role of community health centers and other community-based clinics have within the healthcare landscape in Kansas. Several years ago, many years ago now, we started with just a handful of community health centers and community-based clinics. We now have more than 34 with more than 100 sites. We know that the number of patients has increased 25% over the past 10 years. And we now know that 1 in 10 Kansans are served by a community health center. So tell us a little bit about why you think that growth has happened.
I really think at its simplest that this is a direct reflection of the quality of care that we provide. As community health centers become more established in communities, people are beginning to realize all that they have to offer. We have very patient-focused models of care, and we actually provide more comprehensive and integrated services than many other providers in a community are able to do. I also think it matters that we're exactly what our name implies, community health centers. We're local, we're connected to the communities that we serve, and we're focused on providing great care.
Yeah, I love that. Community health centers are focused on their communities. And we saw that very clearly about 2 years ago now when COVID came to Kansas. And, health centers and community-based clinics were front and center in helping to address the need and to continue to address the need of COVID-19 in Kansas. In doing so, I think that the network of clinics established themselves as a strong partner in the healthcare landscape for the state's emergency response. We at Community Care Network, together with the clinics, were there to help the state shape their testing and vaccine strategy. And I know for a fact that Health Ministries Clinic was one of the first providers of vaccine in Kansas. So, can you describe a little bit about how COVID-19 has impacted Health Ministries Clinic in general and maybe all of the community health centers and, how it has changed the way that you are providing care? And what does that mean to patients, for people in Kansas?
Well, let me just even take a step back. I think we really do view our role as being a resource for the communities that we serve. I think that's one of the characteristics of a community health center that also make us unique. We really want the communities in which we serve to value us and again to see us as a resource. And so part of that involves adapting to the needs of the community. The last 2 years have been a unique example of that, or a heightened example of that, where we've had to step in a lot of different ways. And early on, that meant testing. And so that was an early focus. And so I think many of us in the communities we're at opened up some of the very first testing sites that were available. And didn't just make that available to our patients. Again, it was a very community-focused approach. And so I know that when we did that, it was open to everybody. It wasn't just our patients. And so in that, we looked strongly about how we can partner in that. So it was more about being effective. What did it mean to be effective in the communities that we serve? So for us, we had great local partners. So our public health office was great. Our local community hospital was great, and so that made it really easy. Um, but I think it was adapting to those needs as they changed, and so that quickly shifted from testing to then treatment, and then to vaccines, and that eventual rollout. And so I think we've tried to just carry that mindset through the entire process about what does our community need from us at this time, and how can we best meet those needs.
So, Matthew, tell us a little bit about how COVID changed the way that you provide care and maybe even the kind of care that has continued even as we move through this pandemic.
COVID was certainly a jolt. That may be an understatement. I think what it did for us is it continued a similar pattern of adaptation. Like I said, healthcare, we're used to curveballs being thrown our way. And while this was certainly a doozy of a curveball, it required the same processes of adaptation. So early on for us, what that meant is um, and some of this was altered as information became available, and so early on, the focus was on how can you continue to provide healthcare services in a safe way, keep staff safe, keep patients safe. And so, at its core for us, that was what drove everything that we did. Is how can we continue to see our patients in a safe way? One of the things that came out of that was a renewed emphasis on telehealth services. So telehealth services had existed before. They existed a little bit in the background, weren't widely used. I think for many of us, we spun up telehealth programs overnight. And because we had to, again, because we had to see our patients and find a safe way to do that. And so we'd probably effectively done about 0 telehealth services prior to last March, and then it did thousands over the coming year, and we probably learned 5 or 6 years worth of we had 5 or 6 years worth of experience compressed into a couple months. And so that was definitely something that accelerated a learning process, and that we'll actually take forward, and it continues. Now we're able to step back just a little bit and evaluate how that went, and how to best use that resource in telehealth. So when does it work well, and when is a face-to-face visit still the preferred option? And so I'm not sure we've completely answered that, and that will probably continue to evolve and change as well.
Yeah, Matthew, you guys have done so much in such a little time, and for me, it's kind of it's heartening, and it's hopeful that you were able to take a situation that was really an emergency and learn from it in such a way that you were able to transform the way that you're providing care for the long run, because we did see that telehealth was effective, and especially effective for behavioral health services like mental health and substance use disorder. So as we think about innovation, we can think about this as sort of embedded into the health center movement when President Johnson and Congress actually established the health center movement back in the 1960s. How do you think that focus has stayed with the health centers and other community-based clinics since then? How important is it to address equity, and what is being done to do so?
Well, I think one of the characteristics of community health centers is taking a proactive approach to this issue. I think equity and the pursuit of it is more of a I don't know if you put a journey or a process than a destination. So it's not like you ever fully arrive at equity. I think more recently this has involved something we call social determinants of health, and so it's beginning to look at what are the characteristics that are present in someone's environment, so where they live, work, and play, and how do those end up impacting both the health care that they receive and their overall health. And so I think that's something that I know is a point of emphasis in many of the community health centers now.
So the concept of innovation, let's go there, because I think that is in your collective DNA. If you think back, community health centers were one of the first group of healthcare providers to implement electronic health records. You then became innovators in providing that whole person care, the care that addresses the mind, mouth, and body, as well as the social needs, as you spoke about. Now you're using common data platforms in order to look at some metrics that are common among all of the health centers and community-based clinics that really help to indicate the importance of individual health and whether or not progress is being made, as well as the importance of the community's health and what's happening, what still needs to happen. A lot of this is then, with all of these innovations, it really helps providers to provide the kind of care that is most needed and, as you said, most effective. So how do you think, as you think about this broadly, how do you think that this forward-thinking modality or sort of philosophy really helps in Kansas?
I really get excited about working at a community health center. I mean, it really is a special place to be. I think part of that is because community health centers really are designed and charged with serving as incubators and incubators for ideas. And this is really part of our role. Community health centers are often on the forefront of implementing and trying out new approaches to care. One great example of this, and one that I'm really excited about, is this concept of integrated care. While many of parts of our healthcare system grow more and more specialized and fragmented, community health centers are actually moving in the opposite direction. What we realize is that there are many factors that go into our overall health, and we believe we can ultimately be the most effective in terms of impacting the health outcomes of our patients when we operate from this team-based approach to care. For example, one of the things that many community health centers are doing is exploring how to more fully incorporate behavioral health services directly and seamlessly into the primary care medical services that we provide. We absolutely have patients who transition their care to our clinic because of this approach. The providers and staff also thrive in this kind of setting. So that's just, I think, one example of the innovation. We really actually believe that's the future of healthcare. It just happens to be, for community health centers, the future is today, and that's right now.
So Matthew, let's think about this together. We've talked a lot about how community health centers and community-based clinics are there in their community. We also, though, can define community in many different ways. And, from a statewide organization, we look at a community as also being the entire state. In Kansas, we have 22 community health centers, and then we have about 12 or so other community-based clinics that form what we call a network. With that network, you have some ability to work together in order to increase access to care, in order to even help alleviate some of the workforce shortages, and also overall, help to improve quality of care and health outcomes. What are some ways that you think, or why do you think that that's important in terms of thinking about the power of this network?
Healthcare is complex, and there's really so many different points of impact and things that influence the work that we do. I think one of the real benefits and value of being part of a network like community care is that we have partners and we have collaborators, and so versus competitors. And so I know I'm not sure that a day goes by that somebody on my staff doesn't contact somebody at another community health center. And I think it's far more than once a day. I mean, it's just a continual, that is not something that is unique. I mean, we are in daily contact with one another, learning from one another. I mentioned earlier in an earlier question of this idea that we're incubators and we're always trying things. That's true at the other centers as well. And it's always exciting to talk to your colleagues and peers and hear what they have going on and what they're doing. And in some ways, how they're pushing the boundaries. A lot of what it means to be a community health center is not just sitting back and waiting for patients to come to your clinic. but this idea of how do we go out and reach people also that may not traditionally be accessing healthcare, and so what does that outreach look like? And so I think that's a great example of some of the things that we learn from our colleagues and peers just in conversation, or what are you doing, or how are you reaching your community? I think that has led to things like some of the services that are going on in schools, some of the outreach to long-term care, some of the mobile medical units that are being implemented. So those are just examples of things that when you're talking, or this idea of integrated care that we were talking about earlier. I mean, it sounds like it makes perfect sense, but when you look around and it's not being done anywhere else, and you have to work through all the mechanics and the logistics of it, it's really exciting to be able to have partners that you can engage in those conversations with and really learn from one another. And so I think there's a tremendous value in that.
Yes, I so agree with that. The value of the network is incredible. And it is, as a state organization, we just love working with you all because you are so passionate about what you can do in your own community, but also what you can do together to really improve each other. Like you said, kind of push the boundaries and test some ideas and see where you can go. And for me, I think that leads us to our final question, which is I wholeheartedly believe that the network of health centers and clinics are really helping to shape the future of healthcare in Kansas. You're really improving outcomes, you're improving quality of care, you're improving access to care, and you're setting the stage for tomorrow. So you're a big thinker, you're a visionary. How do you see the the future of healthcare in Kansas looking like? What does that picture what is that picture in your mind?
Yeah, so obviously technology is going to play a big part of that, and we see that, and I mean that's true in all of our lives all the time. So as new technology comes, we need to adapt and incorporate that. So I think obviously remote services I think are going to become more of a future. However, I think one of the things that community health centers have proven over time is that healthcare is a lot more than just a 15-minute appointment in your doctor's office once a year. And I think that's one of the things that we're really honing in on. And so again, as we get into this promotion of wellness, and so not just treating illness, but promoting wellness, I think we're identifying and really moving away. So if we talk about where things are going, I think moving away from this fee-for-service model. I mean, that's been kind of a journey healthcare has been on for a while. And so moving away from this fee-for-service model to more outcomes-based care. And I think we are positioned in a great spot because we've been doing that for decades already. And so this idea of all these other services or all these other things that we know impact people's health, maybe taking advantage of that and continuing to move that conversation forward.
Well, Matthew, I cannot thank you enough for being with us today. I know that you are incredibly busy leading an innovative and visionary health center, and appreciate you being here today to share your thoughts and having this really nice and engaging conversation. So thank you again. We look forward to seeing you in the very near future.
Thank you, Denise.
Health is about so much more than treating illness or disease. It is about becoming healthy and staying healthy. With individuals like Matthew Schmidt and the entire Community Care Board of Directors, we are committed to transforming and creating the new future of healthcare and providing wellness for all. I am Denise Sisman. Join me next time for another State of the Heart.